Top 25 Health Policy Advisor Interview Questions and Answers. Health policy advisors play a vital role in shaping policies that improve public health, strengthen health systems, and support effective governance. They analyze data, evaluate programs, and offer strategic recommendations to decision-makers. Preparing for an interview in this field requires strong communication, analytical thinking, and knowledge of current health challenges. Below are the top 25 Health Policy Advisor Interview Questions and Answers to help you confidently demonstrate your expertise and readiness for the role. 1. Why are you interested in becoming a health policy advisor? I'm interested in becoming a health policy advisor because I am passionate about improving public health outcomes through evidence-based strategies. I enjoy analyzing data, understanding community needs, and developing policies that create long-term impact. This role aligns with my commitment to reducing health disparities and supporting equitable access to care. As a health policy advisor, I can contribute meaningful solutions that improve systems, strengthen programs, and guide informed decision-making for better population health. 2. What skills make you a strong candidate for this role? I bring strong analytical skills, excellent communication abilities, and a deep understanding of public health systems. I'm skilled in research, data interpretation, and stakeholder engagement. I can translate complex information into clear recommendations for decision-makers. My ability to collaborate across sectors, manage multiple priorities, and remain adaptable makes me effective in fast-paced policy environments. These skills allow me to create practical, impactful, and evidence-based policy solutions that address current health challenges. 3. How do you stay informed about current health policy issues? I stay informed by regularly reviewing peer-reviewed journals, government reports, and publications from global health organizations. I follow updates from ministries of health, think tanks, and public health agencies. I also participate in webinars, conferences, and professional networks focused on emerging health policy trends. Staying engaged with academic research and real-world data ensures that my policy recommendations are current, relevant, and align with national and international best practices. 4. Explain the importance of evidence-based policymaking. Evidence-based policymaking ensures that decisions are grounded in reliable data and proven outcomes rather than assumptions or untested ideas. It improves policy effectiveness, enhances resource allocation, and increases public trust. By using scientific research, health indicators, and program evaluations, policymakers can design strategies that address root causes, reduce risks, and improve health outcomes. Evidence-based approaches also support transparency and accountability, ensuring that health policies lead to meaningful and measurable improvements. 5. How would you approach developing a new health policy? I would begin by defining the problem and gathering relevant data to understand its scope and impact. Next, I consult stakeholders, including healthcare providers, public health experts, and affected communities. I review best practices, evaluate possible interventions, and weigh their feasibility and cost-effectiveness. Then I draft policy recommendations supported by evidence. After stakeholder review and revisions, I prepare an implementation plan with monitoring indicators to ensure successful outcomes. 6. Describe your experience with policy research and analysis. I have conducted extensive policy research using quantitative and qualitative methods. My experience includes reviewing scientific literature, analyzing health data, and assessing program effectiveness. I've created policy briefs, feasibility studies, and recommendations based on research findings. I've also evaluated the impact of existing health policies and suggested improvements. My ability to translate complex research into actionable insights helps leaders make informed decisions that enhance public health systems and services. 7. How do you handle conflicting stakeholder interests? I handle conflicts by listening carefully to each party's concerns and identifying their underlying priorities. I aim to find common ground and propose solutions that balance interests while keeping public health goals central. Transparent communication, fairness, and diplomacy are essential. I emphasize evidence-based reasoning to guide decisions and ensure stakeholders understand the rationale behind recommendations. This approach helps build trust and encourages collaboration despite differing viewpoints. 8. How would you evaluate the success of a health policy? I evaluate success by setting clear, measurable indicators before implementation. These may include health outcomes, service utilization, cost effectiveness, or equity improvements. I use data analysis, community feedback, and program monitoring to determine whether objectives were met. Comparing pre- and post-implementation data helps identify trends and gaps. Continuous evaluation allows policies to be refined or expanded. Effective evaluation ensures accountability and helps decision-makers understand what truly improves public health. 9. Describe a time you managed a complex health project. I once managed a project focused on increasing vaccination rates in underserved communities. The project required coordinating multiple stakeholders, including clinics, nonprofit organizations, and community leaders. I conducted needs assessments, created outreach strategies, and established performance indicators. Through collaboration, data-driven decisions, and consistent monitoring, we achieved a significant increase in vaccination uptake. This experience strengthened my ability to manage complex projects and produce impactful health outcomes through strategic planning. 10. What role does health equity play in policymaking? Health equity ensures that every individual has a fair opportunity to achieve optimal health. When developing policies, it's essential to examine how disparities affect different populations and address the root causes. Policies should promote equal access to services, reduce barriers, and ensure resources are allocated based on need. Prioritizing equity leads to more inclusive, effective, and sustainable health outcomes. A strong health policy advisor considers equity in every stage of planning and implementation. 11. How do you handle large amounts of complex health data? I approach complex data by organizing it systematically and identifying key indicators relevant to the policy question. I use analytical tools to interpret trends, compare datasets, and identify patterns. Once analyzed, I simplify the findings into clear, actionable insights that can guide decision-making. I am also careful to validate data sources and ensure accuracy. Handling data effectively supports informed, evidence-based policy recommendations that improve public health outcomes. 12. How would you advise leaders during a public health crisis? I would begin by providing accurate, timely, and evidence-based information about the crisis. I'd outline potential risks, response options, and their likely outcomes. Clear communication and calm guidance are critical. I'd recommend strategies based on scientific data, best practices, and lessons from past emergencies. Coordinating with health agencies, monitoring developments, and adjusting strategies as needed are essential. My goal is to support leaders in making informed decisions that protect public health. 13. What challenges do you think health systems face today? Health systems face challenges such as rising healthcare costs, workforce shortages, aging populations, and unequal access to care. Additionally, emerging infectious diseases and chronic conditions place growing demands on resources. Digital transformation, data management, and ensuring health equity are also major challenges. Addressing these issues requires innovative policies, strong leadership, and collaboration across sectors. As a health policy advisor, I aim to help design solutions that strengthen resilience and improve health system performance. 14. How do you communicate complex policy information to non-technical audiences? I simplify complex information by using clear language, relatable examples, and visual aids such as charts or summaries. I avoid jargon and focus on the key points that matter most to the audience. Structuring the information logically helps ensure clarity. My goal is to make policy issues understandable so decision-makers, community members, or stakeholders can engage effectively. Good communication builds trust and supports informed, collaborative decision-making. 15. What methods do you use to assess community health needs? I use a combination of quantitative data, such as health statistics and surveys, and qualitative data from interviews and focus groups. I examine social determinants, service accessibility, and existing health outcomes. I also collaborate with local organizations and community leaders to gather insights. This mixed methods approach helps identify gaps, prioritize needs, and design effective policies. Understanding community health needs ensures policies are relevant, equitable, and responsive to real challenges. 16. How do you ensure your policy recommendations are feasible? I ensure feasibility by assessing resources, budget limitations, legal considerations, and organizational capacity. I collaborate with stakeholders to understand operational realities and gather feedback. I analyze cost-benefit factors and identify potential implementation barriers. By considering these elements early, I can propose realistic, actionable policies that align with institutional goals. Ensuring feasibility is essential because even strong ideas must be practical to achieve meaningful health improvements. 17. Describe your experience collaborating with government agencies or public health departments. I have worked closely with government health agencies to evaluate programs, develop policy briefs, and coordinate community initiatives. My responsibilities included data analysis, stakeholder engagement, and drafting recommendations aligned with national public health goals. I learned the importance of communication, accountability, and alignment with regulatory frameworks. These collaborations taught me how to navigate government structures and ensure that proposed policies support both community needs and institutional priorities. 18. How do you approach ethical considerations in health policy? Ethical considerations guide every decision in health policy. I ensure policies respect human rights, fairness, and transparency. I examine how decisions affect vulnerable populations and consider unintended consequences. Confidentiality, informed consent, and equity are essential principles. I also engage stakeholders to ensure diverse perspectives are considered. Ethics guide responsible policymaking and ensure that proposed policies promote well-being, trust, and long-term public confidence in the health system. 19. How do you handle tight deadlines and high-pressure environments? I prioritize tasks based on urgency and importance, breaking projects into manageable components. I stay organized with planning tools and maintain clear communication with my team. When pressure increases, I remain calm, focused, and solution-oriented. I am comfortable making evidence-based decisions quickly when needed. My ability to manage deadlines ensures timely delivery of recommendations, especially in fast-moving health policy environments where timely action is critical. 20. What tools or software do you use for data analysis? I am proficient in tools such as Excel, SPSS, and statistical software like R and Stata. I also use data visualization platforms such as Tableau and Power BI to present findings clearly. These tools help me interpret large datasets, identify trends, and support evidence-based policy recommendations. I continue learning new technologies to stay efficient and ensure my analyses remain accurate, relevant, and align with modern health policy workflows. 21. How do you approach policy implementation challenges? I begin by identifying potential barriers early, such as funding, workforce limitations, or stakeholder resistance. I work with teams to create realistic timelines, provide training, and ensure clear communication. Continuous monitoring helps track progress and adjust strategies when necessary. I also prioritize stakeholder engagement to build support and ensure smooth execution. Managing implementation challenges effectively ensures that policies translate into real improvements in public health outcomes. 22. How do you incorporate social determinants of health into policy planning? I incorporate social determinants by examining factors such as education, income, housing, and environment when assessing health needs. Policies must address these underlying issues to create sustainable change. I analyze data to identify disparities and consult with community organizations to understand local challenges. Integrating social determinants ensures that policies promote equity, reduce barriers, and improve overall quality of life. This holistic approach leads to more effective and meaningful health solutions. 23. Describe a time you had to persuade leadership to adopt a policy recommendation. I once proposed a new community outreach strategy to improve chronic disease screening rates. Leadership was hesitant about resource allocation. I presented data showing the long-term cost savings, improved outcomes, and alignment with public health goals. I provided case studies and a phased implementation plan to minimize risk. This evidence-based approach convinced leadership to approve the policy, leading to increased early diagnoses and improved community health outcomes. 24. What do you believe is the biggest issue facing public health today? One major issue is unequal access to healthcare services. Many communities still face barriers due to cost, location, workforce shortages, or social determinants. This leads to disparities in health outcomes, especially for marginalized groups. Addressing this issue requires stronger policies focused on equity, prevention, and system-wide reform. Improving access ensures healthier populations and reduces long-term health care costs. As an advisor, I aim to support solutions that expand fairness and accessibility. 25. Where do you see yourself in 5 years as a health policy advisor? In 5 years, I see myself leading major policy initiatives, mentoring junior analysts, and contributing to long-term strategic planning. I hope to specialize in areas such as health equity, population health, or health system strengthening. I aim to expand my expertise, publish research, and play a key role in shaping impactful health policies. My goal is to advance professionally while supporting meaningful improvements in community and national health outcomes. Health policy advising demands strong analytical abilities, effective communication, and a deep commitment to improving public health. By preparing well for common interview questions, you can demonstrate your knowledge, strategic thinking, and readiness to take on complex challenges. Highlighting your ability to evaluate data, collaborate with stakeholders, and create evidence-based policies will make you a strong candidate. With the right preparation, you'll be ready to contribute to meaningful policy decisions that shape healthier communities.